Yes, so we're now recording, and could you just tell me your first and last name and your title?
I am Raywat Deonandan, epidemiologist and associate professor with the Faculty of Health Sciences at the University of Ottawa.
Perfect, thank you. And what is your reaction to these new measures around masking?
Well, I'm not sure what the new measures actually are, but I'm assuming the masking mandates are being removed. And if that's the case, I think it's a bad idea. And let's go through why I think it's a bad idea. First, if we ask ourselves, what was the situation when the masking mandate was first introduced in Ontario? It was when we had about 150 cases per day. We have over 2,000 cases per day right now. Um, so it's a strange thing to be removing the masks when we have runaway transmission. In fact, in Ottawa, we have about 150 cases per day just in the city of Ottawa. Also, why do we have waves in the first place? It's because we have a susceptible population. And even though we have a high rate of vaccination and probably a high rate of infection that may lead to some level of immunity, we still have a fair number of people who are susceptible, that have no immunity whatsoever. And that means this disease has the opportunity to penetrate that population and create chaos still to a large extent. So masks are a low cost, high impact tool that the citizenry can manage. It doesn't require a lot of government intervention or investment or management. So it strikes me as removing the biggest bang for your buck tool for no particular reason other than possibly optical or political.
So what do you think is going to happen now that March 21st masks are no longer mandatory? What's going to happen?
Yeah, it comes down to whether or not the lack of a mandatory mask means that people will actually stop wearing masks. I think a large number of people will continue wearing, and that my spouse, who's a doctor, and I have been placing bets on what that number will be. Um, I think I think it'll stay quite high. She thinks it'll stay quite low. So we'll see what happens. Um, so assuming that the great majority stop wearing masks, I think we'll see an increase in transmission. I think the numbers will go up, and that might result in increased hospitalization usage and so forth. Take a step back and ask ourselves, who are the people who are the least likely to use masks when the mandate comes down? It's the people who are a bit less worried about this disease and who have made, shall we say, less conservative choices throughout the pandemic. These people are probably also more likely to be unvaccinated and more likely to be more flagrant with their exposures. So we have an increased probability that those people are the ones who are going to be infected and have bad outcomes. So as a result, I'm skeptical about a good outcome coming from this. Now, what should we be doing? I think we should maintain the mandates for a little while longer. When we have the right indicators in place. I don't like the idea of attaching these removal of restrictions to arbitrary calendar dates. They should be tied to observable indicators in the population. Which indicators? I think of three categories: the population indicators, the epidemiological ones, and the systems ones. The health systems indicators are how much space is there in the hospital. The epidemiological indicators are things like how many cases there are, and the population indicators are the extent to which we have vaccination in place. And at an overall population level, we have high vaccination, over 80% of the eligible population. But in individual categories like the school population, it's not that high. So for at the very least, I think it should be maintained in schools because that's the population that is most susceptible. And the CDC suggests that you shouldn't be talking about removing mask mandates until you have a caseload. I think it's 50 cases or less per 100,000 people. I think that's the right cutoff. We're well above that. So there is no scientific rationale, to my mind, to remove the mask mandates. But one is coming, right? If we just hang on for a few more weeks, I think the trend lines would be far more forgiving.
What do you recommend that Ontarians do?
um, I think everyone has to calibrate their personal risk accordingly. If you have someone in your family or in your life who is susceptible, they're unvaccinated, or they're a child under 5 who's not eligible for vaccination, or they're immunocompromised, or they're extremely elderly, or they're a cancer patient, something like that, I think we have to make personal choices now that make sure that we account for the fact that the state is no longer protecting us, which means wearing an N95 caliber respirator whenever you can in outdoor sorry, in exterior indoor settings. And if you haven't got that kind of person in your life, you can make more lax choices. I personally would recommend continuing to wear a mask if you're around strangers in casual settings like shopping and so forth. It's not uncomfortable, it's short duration, and will do some good. The other benefit to masking, though, is not just scientific, it's psychological. You're signaling to other people that you are safe to be around, that you are making consistently good choices, and that puts people at ease to a large extent. Also, the mask has become a symbol of the pandemic. Any newspaper article or blog post you see, the icon next to it is someone wearing a mask. And removing the mask signals to people that this is over. It's not over. We have a ways to go still before it's over. So that's the psychological communications aspect of this. And one of the reasons I would advocate for people to consider continuing to use masks, maybe not all the time, but to some proportion of the time.
Is there anything that I've missed in my line of questioning?
Well, a lot of people will push back and say, where's the evidence that masks work? There is actually pretty good evidence. And those who deny that evidence, I think, are coming from a political standpoint, not necessarily a scientific one. We have evidence at the laboratory level. We have evidence at the mathematical level for simulation studies. We have evidence at the population level, comparing different populations. We have evidence in small population clinical settings. We have a variety of sources of evidence, which is the best kind of multi-focus approach for assessing the quality of an intervention like this. And it's pretty clear that it does work to diminish transmission. Maybe not 100%, but to a large enough extent that it's useful and it's low cost and high impact, and the individual can manage it themselves. So I think people need to put their politics aside and think about this from a strategic perspective and consider that it's a big bang for your buck, and we should continue to attempt to wear masks, at least to a large extent.
Thank you so much for speaking with me today.
It is